At American Back Centers, you've got nothing to lose but the pain.
The following program, BackTalk, is sponsored by American Back Centers.
At American Back Centers, you've got nothing to lose but the pain.
Welcome to BackTalk with Dr. Peter Pedduzi, located at 103 Bradford Road, Building 2, Suite 100 in Wexford. Now, with BackTalk, here is Dr. Peter Pedduzi.
Good morning, everyone. This is Dr. Peter Pedduzi with another episode of BackTalk. So I'd like to start off each and every week. I'd like to say hello to all our loyal listeners. Thank you for listening each and every week. And a special hello to anyone who's new to this radio show. This, again, is BackTalk with myself, Dr. Peter Pedduzi. We're on every Wednesday morning on KHB 620 a.m. from 9 to 10 in the morning. As I do quite frequently, I give you a little preview of what we're going to be talking about today. Of course, if you are new to the show, in the first half hour or so of the show, we talk about the VaxD and all the other very unique and wide variety of treatment options we offer, all under one roof right here at the American Back Centers. Of course, American Back Centers was started almost 50 years ago now by Dr. Dennis Miskovich here in the local Wexford, Cranberry area. In the last 20 years, we've been known as Pittsburgh area's disc specialty center. We have the experience, we have the expertise, and we have the most advanced researched treatment option out there called VaxD. We actually have two medical devices called VaxD, FDA approved for these type of disc problems: herniated disc bulging, extruded disc foot drop, sciatica stenosis. Some of the most severe cases, failed back surgery cases. We've seen them all. We've seen some of the most difficult cases out there. And again, we can't help everybody, but that's why you come in for the consultation. We sit down with you, look at your films, MRI, CT, X-ray, do a detailed history physical exam. Then we determine if you're a candidate, number one, make sure there's no contraindications to the treatment, any reason why we would harm you. And number two, make sure you're a candidate for the therapy. And if we feel you are, because of our expertise and the way we've been doing things over the years, we continue to perfect what we do. Our protocols are unique to the American Back Centers. Even though there's 300-plus VaxD facilities across the country, 3,000 patients a day getting VaxD, what we do at American Back Centers is totally unique. And again, we have the best treatment option with VaxD, and we've been doing it for now over 20 years right here at the American Back Center. So again, one of the most experienced facilities in the country instituting this type of care. We have the expertise, and we are, again, Pittsburgh's disc specialty center for over 20 years now. In the second half hour, we typically talk about a nutrition or fitness-related topic. Last week, we talked about how people are suffering from osteoarthritis and how this has doubled. The number of people suffering, to be exact, from osteoarthritis has doubled. We talked about some of the natural remedies, ways you can prevent this naturally, as well as ways you can help treat this type of issue. We talked about some of the supplements we have here, including hyaluronic acid, glucosamine, chondroitin sulfate. We have a great formula with HA that works very well, that helps to rebuild some of the things that are breaking down, especially as we get older, and you're fighting that uphill battle in many cases. We talked about some of the diet issues that actually promote more problems as well, and some of the natural ways, again, that we are able to kind of fight this down uphill battle and kind of make it more even, so you're not losing more than you're gaining, and trying to get that equilibrium per se. Because as you get older, it's very difficult to gain, but it is very possible to halt the progression of osteoarthritis and make it occur much slower, if not slow it down totally. We talked about some of the factors, including omega-3, omega-6 ratio, diet, lifestyle. We talked about the HA, the glucosamine, all the different formulas we have here at our office that work exceptionally well. If you'd like to try those, you can call our office, pick them up, or we can send them to you. This week we're going to be touching on how to safeguard your bone health naturally, talking more about osteoporosis, as well as the drugs that people are on for arthritis, the painkillers for arthritis. We touched on that last week. We're going to have time to do that. To kind of segue from the osteoarthritis topic, talking about some of the prescription drugs and some of the dangers that you could be making yourself susceptible to by taking these osteoarthritis painkillers and drugs for reducing pain, basically just putting a Band-Aid on the problem. Then we'll switch gears and get into the osteoporosis topic later on the show as well. You can find these right on our Facebook page. I don't think I put them up there yet, but I'll definitely put them up there before the end of the day today. The arthritis patients relying on drugs, as well as how to safeguard your bone health naturally. Both of those are from Mercola, MERCOLA.com. So I'll definitely put those up there today. I didn't have time to put them up there before the show, so I do apologize, but I'll definitely put them up there. Our Facebook page is American Back Centers Pittsburgh. Again, American Back Centers Pittsburgh. Take a second to go to our page. If you like our page, certainly click on the like button. We would appreciate if you liked our page, as well as you can print off the articles we talk about on the radio show each and every week right on the Facebook page by going to American Back Centers Pittsburgh on the Facebook page, or you can go to Mercola.com and get it directly from his website as well. If you don't have a computer or printer, we ask only if you don't have a computer, printer, or access to the Internet, we can send these articles out to you free of charge. That's not an issue whatsoever. We just ask that we don't send it out to everyone. If you do have a computer, you do have access to the Internet, just go ahead and go to our Facebook page and print that off for yourself if you could. All right. So, of course, at the American Back Centers, as we mention each and every week, we are not your typical chiropractic office. Since 1994, the American Back Centers has specialized in the treatment of very difficult cases, including herniated disc, bulging disc, extruded disc, failed back surgery, sciatica, stenosis, degenerative disc disease, and other serious health-related issues, including some of the most serious disc-related issues. Patients come in all the time with foot drop, coming in with walkers, canes. We've had people come in wheelchairs. Their back pain is so debilitating, that they've been to every doctor known to man. They've been through surgery, multiple failed surgeries. They've been to pain clinics for pain shots, epidurals, physical therapy. Didn't help them, or in some cases actually made them worse. We've talked about that on the show many, many times. Well, we do therapy here at the office. We do rehab and therapy very similar to what you'll see at a physical therapist's office, but there's a time and a place for that. And in most cases, the therapy alone is not addressing the actual cause of the problem, the structural compression. They may try traction, which we all know traction, or these so-called decompression machines, are not reducing the pressure in the disc. They're not producing negative pressure. In some cases, they claim to. But again, I ask, show me the research. Show me the research proving that you do what VAC-C does. VAC-C, again, is the only device that has been proven. And this was published way back in 1994 in the Journal of Neurosurgery by two neurosurgeons, where they actually used real-life subjects receiving VAC-C therapy. And be careful that when people produce this research, this was only done on VAC-C. This was done back in 1994, before these other so-called decompression disc treatments were even thought of. How could it have been done on these procedures, and how could this research apply to those procedures? And you have to be very skeptical about that, because obviously they're trying to put something past you when they do this, and we've seen this quite often where they use this research and they say it applies to their procedures, and of course it was only done on vaccine. It was done 20 years ago, over 20 years ago, and again, this was done on real-life subjects with pressure sensors or transducers, showing that negative pressures, upwards of the negative 160 to a negative 200 millimeters of mercury, were produced each and every time you undergo VAC-C therapy, producing that vacuum, reducing the interdiscal pressure, which is unique to VAC-C therapy. So again, VAC-C, as we mentioned, is a time-tested treatment, very safe treatment, very cost-effective treatment, a small fraction of the cost of surgery. Used all over the world now, 300 facilities, hospitals, medical clinics, orthopedic surgeons in private practice, physical therapists, chiropractic physicians using this, 3,000 patients a day currently being treated with VAC-C therapy. This, of course, VAC-C stands for vertebral axial decompression. So as I ask almost every week, if you're out there listening, you yourself are suffering with severe back pain, you know someone suffering with severe back pain or even neck pain, which we'll talk about here in a few moments, unresponsive to your current treatment, you want to avoid pain medication, over-the-counter, prescription. You've been through the Medrol dose pack, the steroid pack, which gave you some relief, but of course structurally, what the heck could that be doing other than just making you feel better temporarily, which is good in some cases, but if you could actually see what's going on in the spine and the back, nothing's really changed. If the disc is bulging, if it's herniated, if it's beginning to compress, beginning to bulge, it's still going to occur. It's still going to progress, even though you did a steroid pack to reduce the inflammation. In most cases, it's still progressing. It's still getting worse. You just covered it up and you feel good, and the pain will come back the next time you do something strenuous or you over time due to the compressive forces, sitting, standing, all the things we do throughout life. We've touched on that many, many times. The importance of moving around for overall health, changing positions throughout the day, not sitting too long, not standing too long, not staying in one position, but most importantly, sitting has been known as the new smoking. And it's not good for your health, number one. We've touched on this many times when we talked about health articles, nutrition articles on the second half of the show, but also it's not good for your back. That's why you're seeing these standing desks. But even so, with that, these disc problems progress over many, many months, if not years, and you cover it up with certain things like steroid packs, pain medication. You go to a pain clinic and get epidurals, pain shots, reducing the inflammation, but structurally not counteracting the compression that's actually causing the problem. Same thing with physical therapy. In many cases, that will strengthen the core, strengthen the disc walls, which is a great thing. But if the case is too severe, and it could irritate the hot disc, because the disc is not going to like any even conservative movement. And that even goes sometimes with adjustments, chiropractic adjustments, which help many cases of disc problems, bulging disc, herniated disc. But in some cases it doesn't, and now it's irritating. And that's where we come in many cases where the patients are referred to us from other chiropractic doctors, physical therapists, where they've hit a wall with the condition. The condition's not getting any better. It may be getting worse because it's met the limitations of the treatment, and that's where VAC-C comes in. VAC-C can address some of the most difficult disc cases because it's actually addressing the actual disc, the actual cause of the problem, the compression on the spine leading to loss of height of the disc space, compression on the disc leading to bulging, herniation, extrusion, leading to the disc being impinging, I should say, on the nerve, causing you pain in the hip buttocks going down the leg, numbness and tingling, weakness, foot drop, all the things we see, sciatica, even spinal stenosis. The disc is pushing out into the canal, narrowing that canal, central spinal stenosis, where the disc can be pushed out into the holes, the foramen we call them, in which the nerves come out of, causing foraminal stenosis, impinging on those nerve roots and causing the pain that you may be experiencing. VAC-C can pull that disc off the nerve, relieving your spinal stenosis, pulling that disc out of the canals that it's occluding, relieving your sciatic pain, relieving your numbness, your tingling, your weakness, your foot drop. In many cases, you don't even know you have this type of problem, and you can come in and talk with us if we feel, after examining you, that you need an MRI or CT scan, depending on if you have metal or a pacemaker in your body, you'd have to get a CT scan. Then we can determine more accurately if you have these type of problems. So also, if you're contemplating surgery or you've already had a failed surgery, please come and talk to us first before you undergo another surgical procedure. Each surgical procedure, as you know, and if you listen to this show, has a lower success rate than the first and a higher rate of complication. And some of these complications can be permanent. Scar tissue, we see this every day on MRIs, fibrosis, scar tissue, infections that can occur. We've had patients coming in here with just standard surgeries, not even spinal surgeries, knee surgeries, where they had massive infections. They had to take the prosthetic out, clean it up with high-dose antibiotics, and put it back in. We talked about the hemp oil, how the one patient we had it comes in here, the knee infection, the only thing that actually touched his pain, because the pain was so bad from his failed knee surgery where he had the infection, that none of the prescription painkillers were even touching the pain. He used the high-dose level 5 hemp oil that we have here, and we had the Healthy Hemp Solution, Jay Miranda, on the show about a month ago, and that was the only thing that gave him relief. And the nice thing about the hemp oil is it's natural, and there's no known side effects with the hemp oil. So, again, we'll touch more on that later on the show today. But, of course, if you'd like to try the high-dose level 5 hemp oil. When I say high-dose, high level of CBD, so there's no THC. It's not the THC is what gives you the high, per se. The CBD does not give you any high whatsoever, just pain relief. All right, so again, always, I tell people, always at least call us first, at least come in and get a second opinion first before you blindly undergo the knife. So many people just listen to the primary care doctor, go through the gauntlet, I call it, pain medication, physical therapy, pain clinics where they get the epidurals. They go to the surgeon tells them that either they should get surgery or they should wait, go back to physical therapy, do more physical therapy in some cases, do more pain shots, and then finally they're back at the surgeon's door thinking that their only option is surgery. And that's simply not the case. And hopefully you out there listening will tell your friends, relatives, neighbors in these situations that they do have a very safe, effective. Over 20 years we've been helping thousands of people, celebrities, professional athletes here locally, avoid these type of problems so they don't have to undergo the knife and the possible permanent complications that can result with those procedures. And a very low success rate that occurs with those procedures as well, and sometimes very high out-of-pocket expense. That Laser Spinal Institute, $20,000 to $40,000 out of pocket. They don't tell you that up front, whether it's your copay, your co-insurance, whatever it may be, or just out-of-pocket expense because it's not covered by insurance. Tremendous out-of-pocket expense, and if you look closely at it, they still have to rip out ligament, bone, and tissue before that laser even goes in, causing permanent damage. And most surgeons that don't do the laser procedure will tell you it's the same thing. All they're doing is using a laser as opposed to a scalpel, which is not as precise in their opinion, not as accurate. They don't have as much control about how far they're going in, the depth of penetration, as well as control overall. And they're doing the same thing, just snipping off a piece of the disc, whether it's through a laser or a scalpel, still not addressing the compression, the cause of the problem. So a lot of people don't understand that. They think, oh, it's a less invasive procedure, smaller incision. In most cases, it's the same incision. They still have to rip out ligament, bone, and tissue, and you have tremendous out-of-pocket expense. And the most important thing is it's doing essentially the same thing as the discectomy, snipping off a piece of the disc, again, not addressing the compression, the true cause of the problem. And in most cases, patients have to go in, whether it's 6 months, a year, 2 years, 3 years for another procedure. And they claim success, but what is success, as I always mention? Is it 1 week? Is it 6 months? Is it 1 year? Is it 3 years? Is it 4 years? But then the pain and the condition eventually progresses, and they have to go back for another procedure because of this. With Vaxi, we have research showing that 4 years plus, patients are still pain-free. This was published in the journal Anesthesiology. This was done a few years ago and continues to be replicated and shown to be proof in the pudding, as I say, that patients remain pain-free when they follow the rehab program which we give them, keeping their core strong, lifting and bending correctly, doing things right. Their condition remains permanent, and they do not have to come in for repeat treatments in many cases. Doctors, we are doctors dedicated to bringing you long-term relief and avoiding the need for surgery now as well as into the future. Don't wait until your condition worsens. Call us today. We do have a toll-free number to schedule your free consultation at 1-888-222-8293. Again, 1-888-222-8293 or 724-935-3300. If you'd like to fax over any reports, as I talk about all the time, we have people coming from a great distance to come see us. In some cases, you can fax over the consult. I should say you can fax over the reports prior to your consultation. A lot of people schedule their consults, and they want their reports to be here. They can't go pick it up or whatever it may be. You can just have it faxed over from the facility that you had it done at. The fax number is 724-935-3321. 724-935-3321. Remember, that's the fax number. The 3300 number is our office number to schedule a consult with us. Also, you can go on our website, www.americanbackcenters.com. Again, www.americanbackcenters.com, and request an appointment right on the website. You can learn a lot about our office and learn a lot about the VaxD. If you have someone that you know, of course, we can send you some information or send them some information that's contemplating the procedure, you can also send them to our website, and you can get a lot of the same information on the website as well. We also have the 24-page Keller booklet we can send out to you or to anyone you know with these type of conditions. We also have some other information we can send out to you, which I usually go over later on the show. All right, in addition, excuse me, to the VAX-D, which is a medical procedure, it's the only FDA-approved, safe, clinically proven, non-surgical disc treatment out there, used by medical doctors. Excuse me, a little frog in my throat today. Doctors of chiropractic and orthopedic surgeons worldwide in over 300 facilities. Approximately 3,000 patients a day are currently being treated, as I mentioned over and over on this show. It's so impressive, though. No other so-called disc treatment can even come close to that. Some of these facilities may have, 3 facilities. They may have, these traction treatments here or there. And that's why you can just see it, and it makes sense. VAX-D's been around for 20 years. It continues to perfect. We have the newest VAX-D tables. They perfected their technology. So many doctors, all specialties are using it, not just a few specialties. And that tells you something right there. All specialties accept it, see it as a successful treatment, and there's tons more patients a day being treated with this procedure. And all the research, and that's not including all the research that has been done on VAX-D. We also offer a cervical disc treatment, so if you have bulging, herniated disc problems in the neck region, failed neck surgery, you're contemplating neck surgery, give us a call first before you blindly undergo the knife. As I say over and over and over, we have great state-of-the-art successful treatments for the neck disc problems as well. State-of-the-art facilities, therapy and rehab. We do therapy and rehab for the neck, back, shoulder, knee, ankle, foot problems, any musculoskeletal issue, tendonitis, rotator cuff, carpal tunnel, frozen shoulder, tennis elbow. The list goes on and on and on. We have an excellent 25-year experienced licensed massage therapist, deep tissue massage, myofascial trigger point therapy, acupressure reflexology, and comprehensive nutritional consultations through standard process. Wonderful, wonderful consultation, very comprehensive. Custom-made orthotics, computerized digital scanning system, 3D scanning. We're going to touch on this a little bit more here later on the show. Really, really showing. Patients are really impressed because it's not something we get off the shelf in the back. It's custom made to your individual scan of your foot. The patients stand on the scanner. It's very easy, so there's no error. There's no doctor or patient error. You simply just stand on the 3D scanner. It scans your foot in all directions, and it assesses your weight bearing as well as any type of foot issues that may be incurring. It gives us a nice computer Keller printout of what the problems are, describing them in detail. If you have problems, and then if you so choose, it's sent electronically to the company. This company is the number one orthotic company in the world. They make the most. They've been around for a long time, and they're extremely successful in what they do. They send you back within 5 to 7 business days a custom-made orthotic. We also do acupressure. Good example is for sinus drainage. We have great success with our acupressure treatments. In-house X-ray, so if you need an X-ray, we can do it right here. Nerve conduction ultrasound testing, we can have a facility come into the office, Lakeside Medical, and do that for you. If you need nerve conduction ultrasound testing, we can do it right here. In a convenient MRI CT facility, North Pittsburgh Imaging, right across the street from our office. And I'm also finally a certified personal trainer, so I can help you if you need it. To get back in the gym, I can always give you advice on things you should and should not be doing. And many people have good intentions, as I always say, and they end up hurting themselves, exercising and trying to stay healthy. So I can definitely help you with that, being a certified trainer as well as a doctor of chiropractic. So some of the questions we have from patients all the time is, why don't we manipulate? We are, a chiropractic office. We mentioned it's not a typical chiropractic office because we do specialize as a disc specialty center. And in many cases, when a patient comes in, we'll sit down with them and say, you've already been to a chiropractor, you've already been through physical therapy, you've tried these things, now we have an MRI, we have a more severe disc problem, and we need to just take a step back, let the VAX-D, if you are approved or a candidate for the VAX-D, let the VAX-D do its job. We restrict your activities. We have a whole list of things you can and cannot do initially with our disc protocols. We have you wear a back brace all waking hours initially, and we're very cautious in the first couple weeks. We let the VAX-D do what it does, get the disc stabilized and settled down. Once we feel the disc is stable, then we start slowly instituting the therapy and rehab levels 1, then level 2, level 3. We wean you off the back support once we start building up a natural back support. And that's very important to take that in a slow progression and make sure the patient is ready. Every patient is different and how quickly they respond to the VAX-D. And then toward the end of the treatment protocol, we start adjusting the patient again because, as I mentioned, therapy and sometimes adjustments in the very acute stages of a severe disc problem sometimes can irritate the problem. So we take a step back from that. We see on the x-ray the patient have misalignment. They have need for an adjustment, but they also have a huge extrusion or a herniation of a disc. So again, we treat that first as a primary issue, and then the misalignment as secondary, and then we do those at the appropriate time, and then we encourage the patient to go back to the local chiropractor, and or if they want to continue, if they didn't have one, continue with chiropractic care here at our office once the disc condition has settled down. We have specific supplements for disc patients, natural anti-inflammatories, as well as rebuilding of the disc material as well, specific to our office, which is very unique. And we have specific protocols, as we mentioned over and over and over, with our disc patients that we've tried and tested over 20-plus years of treating disc patients. So we have the experience. We have the unique protocols found only here at the American Back Center. There's some great things. If you get that 24-page booklet, which we can send you free of charge, in that booklet showing the ins and outs of VAX-D, there's some great before and after pictures showing MRIs of patients with severe disc problems, degenerative disc disease, severe herniation. And after the VAX-D, you can see it on the MRI. Herniation is reduced, pushed back into place, rehydration of the disc. The disc is the fluid has returned to the disc, and major improvement, visible results with VAX-D before and after with pre and post MRIs. You can see that. Real science, real studies, many published studies in peer-reviewed medical journals supporting the effectiveness of VAX-D. We have that medical textbook, The Practice of Minimally Invasive Spinal Technique Used in Medical Schools, stating VAX-D should not be considered traction in the traditional sense, but as decompression. And this is a very important statement. VAX-D is the only non-invasive treatment. Again, this is from a medical textbook used in medical schools. VAX-D is the only non-invasive treatment that has been proven to decompress the disc. With other traction devices, there has only been indirect proof. Very important to note that. Again, we're seeing these patients before and after. The proof is in the pudding. Unfortunately, many patients cannot get a post-VAX-D MRI because the insurance companies won't pay for it. And it's quite simply that if you're feeling good, they don't want to pay for any type of imaging because they only want to pay for imaging if you're not feeling good. And we've had many patients pay out of their own pocket for MRIs, and you definitely can see the change. But unfortunately, as you can see, the insurance companies will not do that because there are reasons, which are if you have no pain, that means you don't have a problem. There's no reason to do imaging to see that you have no problem. Unfortunate, but that's just the way it is. All right, so if you'd like to, we talked about scheduling a free consultation. Again, our toll-free number is 1-888-222-8293 or 724-935-3300. We encourage you to bring somebody in if you can. It's not essential to help drive you out here. Number one, if you're in pain, a friend, neighbor, spouse, relative, whoever can come with you. We encourage you to bring somebody with you when you come in for your consultation. We sit down with you, answer all your questions, number one. And once your questions are answered, then we do a detailed history, physical exam, and then we determine, number one, if you're, number one, making sure there's no contraindications to the treatment, and then number two, making sure you're a candidate for the therapy, the VAX-D, the cervical decompression, or any of the other options we mentioned today in the first half of the show that we offer here, all under one roof right here at the American Back Centers. We also offer a DVD. This is when Channel 11 WPXI did a medical breakthroughs report on our office. We're very proud of this. They brought the TV cameras out. We're on Channel 11 News. They basically described how we've been helping people over the years avoid these type of disc problems naturally. It's a safe, effective, natural alternative. Dr. Miskovich is interviewed. It's a great way for you to see the vaccine operation. If you have a DVD player on your computer or at home, you can watch it. Just call us and ask for the free DVD, as well as the 24-page Keller booklet showing you all the ins and outs of VaxD and really describing how it works. Some great patient testimonials, which I'm going to give you one here in a few moments from the booklet. We have the research papers we typically send out to you. First paper is published in the Canadian Journal of Clinical Medicine. This research is done right here at the American Back Centers, so we're very proud of that. A Knife in the Back article showing, again, the failures of back surgery and why fusion surgery specifically is not the best approach for chronic back pain, why, again, it's such a money-making procedure for these hospitals and medical clinics. We have the blue workers' comp booklet and the yellow auto accident booklets, both free booklets done by attorneys. They're not going to be calling you. They're out in the Philadelphia region, but they still continue to give us these booklets when we run out. And we do run out quickly because these are so valuable. So many people are hurt at work. They're taken advantage of by the insurance company or the employer. You need to know your rights, and many people don't know their rights, and they're blindly taken advantage of. We've had people all the time call us and tell us, well, the employer told me I had to go back to work, I can't do this, I can't do that, and most of it is simply untrue. They're just intimidating you in many cases. I've had people, I don't remember exactly how it went, but I know he wasn't lifting something at work. He pulled or pushed something, and they said since he wasn't lifting something, he couldn't file a workers' comp claim. And that's totally, I don't think in the 20-some years or the 15 years I've been doing this that I've heard that ever, and it's just so ludicrous that somebody would tell somebody that no matter what you do. You can even be sitting. I've had a patient who was sitting on an airplane. He went to get up, and he threw out his back, and it wasn't because he got up or lifted anything. It's just because he was sitting for many, many years. Part of his job is he sits on an airplane, and the compression on the spine over the years is what caused the problem. And that one incident when he went to get up is what just set off the symptoms. So it's just, you don't have to be lifting something. You don't have to be doing a strenuous activity to hurt yourself. And these are some of the things that this book outlines. And again, we're not pushing you to file workers' comp claims. We just want to make sure you're not taken advantage of. And that's what these booklets are made for, showing you your rights. A lot of people are told they can't get compensation when they're hurt. They're forced back to work. They have to go to these workers' comp panels. Doctors, we all know how they are. They want to get you back to work as soon as possible. They want to limit your condition. You may have a disc problem, and they're going to give you a lumbar sprain strain diagnosis. They're going to be very hesitant to order an MRI because if they get that MRI, now it's going to show a disc problem, and then it opens up another can of worms. And that's where you would come in with us, where you could call us. And again, we have the disc-specific treatments that are extremely effective for these type of problems. And it's all about getting you back to work as soon as possible and limiting the compensation they have to pay you. So that's the game that they play. So this booklet outlines that. So if you know one's been hurt at work, please call and get this free blue workers' comp book. You can also call us if you have any questions. And you, of course, come in if you think you may have a disc condition in the neck or the back. Car accident, the yellow booklet, remember, is a free booklet as well by an attorney. Call to get that booklet. If you've been involved in a car accident, whiplash case, we have excellent treatment options, rehab, chiropractic massage, all under one roof. Very effective for whiplash, car accident cases. You may have developed a disc problem from a car accident. Definitely give us a call for the cervical disc treatments we offer here that are unique to the American Back Centers. So call and get the blue workers' comp and the yellow auto accident booklet. They're both totally free of charge. I want to give you a quick testimonial. This is from our 24-page Keller booklet. Goes on to state, this is a Joseph. I remember that before VaxD there was pain. It was so intense that whenever I sat down, it would radiate to my right leg as well as to my knee. My feet would quickly become numb. I tried to avoid anything that would involve sitting and could not sleep at night because of the pain I felt. After 4 or 5 VaxD treatments, the numbness of my feet were gone. I noticed relief of pain after 9 to 10 treatments, and by the 12th, I felt so good that I honestly thought I didn't need any more. The physician then recommended that I do some additional sessions, and I have to say that was the best advice that I received in a long time. At the end of my last 5 treatments, my back pain was completely gone, and I am still pain-free to date. So wonderful, wonderful testimony. We have many, many of them on our website, as well as in the 24-page color booklet. Our website, again, is www.AmericanBackCenters.com. So check that out today. Again, American Back Centers, plural, with an S.com. You can also visit our Facebook page, American Back Centers Pittsburgh. Print off any of the health articles that we touch on this show. I didn't put up the ones that we're talking about today quite yet, so I definitely will do that sometime today. Typically right after the show I should do it. So it shouldn't be long if you want to get those articles. Take a second to like our page as well. If you go to the website, American Back Centers Pittsburgh, I should say www.AmericanBackCenters.com, the website, you can also subscribe to our daily health update newsletter, which is sent to your email free of charge each and every day with health tips and a quote. Great way to start off the day with an inspirational quote. You also automatically get signed up for a once-a-month, more lengthy, In Good Hands newsletter. Some of the greatest minds in the country. People have been on Dr. Oz, The Doctor Show, Cleveland Clinic director, medical chief wellness director at Cleveland Clinic. Dr. Mike Rosen contributes to this as well. Once a month, you get that free of charge when you sign up for the daily health update newsletter. So check that out today. Give us your email, and you're signed up automatically for that by going to www.AmericanBackCenters.com. All right, when we talked about, just briefly here, the orthotics and the custom-made orthotics, low back pain, check the feet. And in many cases, when you have low back pain, when you have hip pain, when you have knee pain, a lot of that is due to the kinetic chain and problems in the feet. Excessive pronation, fallen arches, bunions, hammer toes can all be contributed to the foot and putting stress on the knee, on the hip, the back, and in some cases all the way up into the compensation, all the way up into the neck. And this can cause chronic pain. This has been shown to result in specific degenerative changes, so arthritis can develop in the knees and the hips. And a lot of it is due to the fact that there's problems, structural strains, and issues in the kinetic chain starting in the foot. So the feet are the foundation of the body. So it's very important to take a look, at least take a look at the feet, I should say, leg or foot asymmetries, alignment problems are present. These abnormal forces are transmitted along the closed kinetic chain, interfering with spinal function. So many of our patients have been suffering with hip or knee pain. Of course, we look at the areas above and below. We see that the feet are a problem. We address that with custom-made orthotics, and it makes a true difference for the wear and tear on those knees and the hips. And it's a wonderful thing because, yes, they're taking supplements which help, and we're going to be touching on some of those supplements today. We touched on some of them last week with the HA and different products we have here, but really addressing the cause of the problem really goes a long way, and we look at those feet, and it makes a true difference. So if you'd like to get a free assessment, and all you have to do is come in, schedule a consultation for the 3D scanner. You simply just step on the scanner, 1 foot at a time. We scan the feet, we assess the problem, and we see if there's any issues that need to be addressed. Simple as that. And if you have issues, we decide to get them made. 5 to 7 business days, they're sent electronically, sent back to us, and they're fitted to your shoes. And they are truly effective and wonderful products. All right, a couple more things before we get into the nutrition segment. We have the Intramax. If you're looking for an all-in-one liquid multivitamin, I take it myself. It's wonderful. It's great. It's not a big pill. It's just liquid. You literally take 1 ounce a day. Highly absorb, easy on the digestive tract and the stomach. 100% organic liquid. 415 ingredients in each bottle. 71 trace minerals. Wonderfully complete product. I've not seen anything this complete ever. 100% natural, 100% vegetarian. No preservatives, no fat, cholesterol, wheat, gluten, caffeine, corn. Basically, yeast, nothing artificial. No artificial additives, no colors, no sugar, no chemicals, starch binders, no flow agents, no antibiotics, no drugs whatsoever. Completely natural. A wonderful, the best multivitamin I have ever seen. You're getting what you're paying for because you're actually absorbing the product. You're not hoping that the product is absorbed. Some of these big horse pills or powders. Wonderful product. Intramax for the adults, Intra-Kid for the kids under the age of 18. We offer free shipping for trying your first bottle or a $5 discount if you pick it up here at the American Back Centers. Of course, just a reminder again, we have the CBT cream, cannabis-infused level 5, level 1 through level 5. These products for pain, and inflammation, completely legal in all 50 states. We also have the hemp oil, the sublingual oil that you can put underneath your tongue, a concentrated oil. Again, you put on your tongue. They're seeing some good results with autism, tremors, and Parkinson's, as well as seizures and epilepsy. Our products are very competitively priced. I've seen a lot of people, they're paying a lot more for their hemp oil. The hemp oil is not cheap, I will tell you that, but our products are much cheaper than what I've seen. I'm very surprised at what people are charging, both the cream and the oil. So if you'd like to try it, the CBD cream or the hemp oil, just give us a call. Some amazing, amazing things are happening with this natural product called hemp oil. So give us a call if you'd like to try that. Also, we have the Natural Calm product, which is flying off the shelves. It's an anti-stress magnesium drink. It's a powder, I should say, 100% natural, only sweetened with stevia. Wonderful product for calming the body, muscle spasms, anti-stress, cramping at night. Wonderful product. It's vegan formula, gluten-free, non-GMO. And finally, we have the L-arginine Complete, which we touch on a lot on this show, producing that nitric oxide to help dilate the blood vessels, possibly, in many cases, reducing blood pressure. Very effective for neuropathy, circulation, sexual performance, lack of endurance, fatigue. All these things that occur when you're not producing nitric oxide, the dilation of blood vessels can occur again, resulting in a natural increase in blood flow, circulation, as well as reduction in blood pressure in many cases. I want to make a quick note, too. I'm a member of a business group, and we meet every Thursday morning at the Sports Girl in Cranberry, which is at 1294 Freedom Road in Cranberry, right next to the Quaker State. Again, it's called the Sports Girl Cranberry, and we meet every Thursday morning at 8 a.m. We're having a Visitors Day. We are inviting anyone who'd like to come by. It's a breakfast group where we meet. We do exchange referrals and talk, and we have different speakers each and every week. If you'd like to come by, we are offering. You can come by on our Visitors Day, which is tomorrow, Thursday, at 8 a.m. And again, that's the Thursday the 21st, which is tomorrow. You can feel free to stop by right at the Sports Girl in Cranberry. Again, it's at 1294 Freedom Road in Cranberry Township. Feel free to stop by. If you have business cards, you can bring those with you as well. We'll be meeting every Thursday at 8 a.m. at that location, but we're having our special Visitors Day tomorrow if you'd like to stop by, and you can be our guest free of charge. So definitely do that if you can. If you're in the area, stop by again, the Sports Girl at Cranberry, tomorrow morning at 8 a.m., and you can meet myself as well as any of the other people that are in our business group. Again, and finally, before we get into the nutrition segment, the real question should be, why would you even think about surgery with all its complications and lack of success, not including the normal risks, including infection, bleeding, or even blood clots that can result in death when Vaxi is an option? Remember, Vaxi is a non-invasive treatment. It's a medical device, very safe treatment with a much, much higher success rate than surgery, pain injections, or physical therapy. Many patients go this route and eventually end up at our office wishing they would have come to us first. Remember, Vaxi addresses the structural issues, not just the symptoms. Truly addressing the cause of the problem, taking the compression off the spine, the disc, relieving pain associated with low back pain, disc problems, herniated, extruded, bulge, degenerative disc disease, sciatica, stenosis, and even failed back surgery cases. All right, we're going to get into our nutritional segments, and first, why arthritis patients should not rely on drugs. As we talked about last week with osteoarthritis, arthritis is one of the most common joint diseases in the United States. Nearly 50 million Americans diagnosed with osteoarthritis, the most prevalent form. Osteoarthritis is a degenerative disease where the cartilage within your joints become damaged over time, and the synovial fluid that lubricates and cushions the joints decreases over time. So we talked about some of the things you can do. We talked about the HA, the glucosamine, omega-3s. May help prevent osteoarthritis. We touched on the omega-3, omega-6 ratio, which is not good in the Western society. We talked about the importance of vitamin D, incorporating that. Bone broth, if you listen to the show. We have a great formula called Boswellia Complex that has the Boswellia, the ginger root, as well as the turmeric, all natural anti-inflammatories, all in one formula. We touched on those last week. So as we go on, painkillers will only add to your problem. A lot of people are taking these painkillers or opiates One of the most commonly used medications in the United States. We all seen what it's happening with Tiger Woods, his fourth failed back surgery, and he's now addicted to opiates. He was basically falling asleep in a car, and they found him passed out, doped up on opiates. These opiates and painkillers are used to ease the pain caused by surgeries, chronic back pain, or even joint disorders. Some of the most common pain relievers include morphine, codeine, oxycodone, hydrocodone, and fentanyl. These drugs function by binding themselves to the receptors in your brain to reduce the perception of pain. They can also induce short-term feelings of euphoria, followed by dysphoria, the reasons for drug dependence and addiction. This drives some people to take the drugs in higher doses to relieve the pain and even combat withdrawal effects. Overuse of opiates can cause sedation, impaired breathing, and even death, and of course addiction. Another class of drugs frequently used to address pain is non-steroid anti-inflammatories. These NSAIDs are the most dangerous drugs today. And some of them have been pulled from the market. Even the FDA warns against using them, and they are linked to cardiovascular problems, GI risk, increased blood pressure, as well as kidney issues. Acetaminophen, or Tylenol, is another popular painkiller. However, this drug is regarded as the most common cause of acute liver failure among Americans. The bottom line is drugs do not come without risk, and conventional treatments always involve these drugs. Dr. McCullough says that while using these drugs to get rid of pain is completely understandable short-term, and I agree with this. I always tell patients short-term, okay. Long-term, you got to be careful. There's numerous natural and risk-free pain-killing options that you can at least try first before you blindly undergo using these prescription pain pills. Next paragraph, relieving arthritis pain naturally and safely. Studies suggest that having a diet rich in omega-3s, again, here it is again, omega-3 fatty acids, can help reduce the occurrence of arthritis. Omega-3 fats function as a natural anti-inflammatory, just as we touched on last week. Compounds that stop inflammation before they damage a tissue completely. Normally, you can obtain significant amounts of omega-3s by consuming fish, especially mercury-free fish. Wild-caught salmon is one example of that. Mackerel, herring, sardines, anchovies are all good natural sources of omega-3s. In addition, some other natural anti-inflammatories, which we touched on last week, ginger root, boswellia, turmeric. We have that all in one formula if you want it in a supplement form. Bromelain, found in pineapples. Cayenne cream, evening primrose oil, black currant, and borage oils have natural fatty acid gamma-linoleic acid, or GLA, that helps ease arthritic pain. Also, inactivity can cause and worsen arthritis. Most people believe that movement causes arthritis, but in reality, being active can help reduce the severity of osteoarthritis. In order to construct a comprehensive exercise plan, there's a few factors that need to be considered. Dr. McCorwell advises reducing your workout intensity or choosing another activity in which you find yourself pain an hour, or choosing another type of activity if you find yourself in pain an hour after exercise. He also endorses use of assistive devices to lessen the pressure on the affected joints during your workout. So you should always consult a professional trainer like myself or a doctor to learn the best workout plan for you. Make sure your exercise routine can help strengthen the quad muscles at the front of your thighs. Instead of running, you're more to benefit from non-weight-bearing activities such as swimming or cycling. Dr. McCool also says if you exercise regularly in order to manage your weight, you will reduce your risk of developing arthritis. Exercising will prevent any type of joint pain from happening in the first place and reduce the need for you to use any type of drug-based treatment. So as we skip on over to the topic of how to safeguard your bone health naturally, we talk about the issue of osteoporosis, which is a common problem as well, affecting an estimated 1 in 10 women worldwide by the age of 60. By the time a woman reaches the age of 80, she has a 2 in 5 chance of developing osteoporosis, and most people sometime during the 30s, your bone mass will start to gradually decline. That's why we tell people, and it's hard to tell a 20 or 30-year-old woman or girl to do things right. Don't drink soda pop. Don't smoke. These are all things. Don't drink coffee. These are all things that leach calcium from your bones. For women, the bone loss can significantly speed up during the first decade of menopause. Stats show worldwide 1 in 3 women, 1 in 5 men over the age of 50 will experience an osteoporotic-related bone fracture. As we skip on down, weight-bearing exercises are particularly important for prevention of osteoporosis, which is characterized by porous and frail bones. And unfortunately, the drugs are typically the first-line remedy recommended by conventional doctors. And in many cases, as we talked about with these, as we skip on down to the case against drugs, these drugs such as Beniva, Fosamax, are associated with a twofold increased risk of esophageal cancer. Research has also shown that over time, these type of drugs can actually worsen your condition because all you're doing is fooling your body into producing dense but weaker bones. So it's rebuilding bones that are poor and frail. And as we talk about more, it may sound like an oxymoron, but here's how it works. Healthy bones maintain strength from a continual process of bone breakdown and bone remodeling. Osteoclasts are cells that break down bone. Osteoblasts are cells that rebuild it. Healthy bone undergoes a dynamic process of removal of unhealthy bone, replacement with new bone. This is how they remain strong. The problem with these drugs is they do build new bone, but these drugs work by killing off the osteoclasts. That halts the normal bone repair process since you now lack the cells that break bone down. The end result is not increased bone density, but the dense bone is not stronger. So I should take that back. The end result is increased bone density, but the dense bone is not stronger. It's very frail. Eventually your bones become weaker and more prone to fracture. In women that have been taking osteoporosis drugs for 5 or more years, the bones have literally lost the ability to regenerate, and this is why so many are faced with brittle bones and fractures, even though they're taking the Beniva and Fosamax drugs. So your lifestyle largely determines the osteoporosis risk, is the next paragraph. You touch on some of the weight-bearing exercises as the most effective remedies against osteoporosis and prevention. The walking lunge is a great exercise for building bone density. It's safe. You can do this without any weights. Building exercises such as yoga and Tai Chi are also recommended, and they are safe because the risk of falling is minimized. And when you do these exercises, the risk of falling is minimized as well because you're building stronger muscle, bone, and your balance. And we all know, we talk about this, balance does decrease. Balance centers does decrease as you get older. And with that, the risk of falling increases and breaking a bone. We talked about some of the therapies we have here at the office, the whole body vibration therapy, some of the balance training we do here at the office. But a lot of the stuff, some of the stuff you can do at home without machines to help increase your balance, stronger, make your muscles stronger in bones, and again, helping you prevent falls, which we touched on here the last few weeks on the show. Aside from walking lunges, high-impact exercises such as sprinting and jumping are also very effective if you can do that. Also, weight training can be effective as weight-bearing. Dancing, higher-impact aerobics, hiking, jumping rope, climbing stairs, playing tennis, even pickleball, which some people will call old people's tennis, which I mean no disrespect, but it is a less invasive form of tennis. It's called pickleball, smaller courts. You're not running around as much, but you're still getting good weight-bearing exercise. Low-impact aerobics, stair-step machines, and fast walking. I always advocate walking rather than running or jogging. Less stress on the spine, the discs, and still getting weight-bearing. In lieu of weights, you can just use your body weight, elastic bands, or functional movements, such as simply just raising and lowering your body onto your tippy toes. So these are some things you can do. We talked about whole body vibration training. He talks about here next in the article here again. We offer it here at our office with a power plate to improve bone strength and density by just standing on the vibration therapy. You can do that 3 times a week for 6 months. Research showing increased lumbar spine bone density by 2%. We talked about the issue also of nitric oxide and the dumping of nitric oxide through high-intensity exercising can benefit your health, triggering the release of nitric oxide, the gas and antioxidant properties that protect your heart by relaxing the blood vessels, which we just touched on with the L-arginine complete, lowering your blood pressure, stimulating your brain, and killing bacteria. So you can naturally produce nitric oxide even more by doing this high-intensity exercise program that he has on his website. Basically, we touch on this on the show many times, just doing short bursts of high-intensity activity, getting the heart rate up, triggering the release of nitric oxide, stimulating anabolic muscle building, giving you more exercise benefits in a shorter period of time. So you're working out intensely, taking a break, working out intensely, and doing this for only a short period of time, maybe a half an hour at max, and then doing it again on another day. Older adults benefit from high-intensity exercise, which she touches on in the article as well. You can read through that if you get a copy of the article. We don't have time to go through the whole thing. But more importantly, I want to get down to avoiding processed foods and sodas, which we touched about, which increase bone damage by depleting the bones of calcium, ditching the processed foods, the soda pop, the coffee, the caffeine that leaches calcium from the bones, increasing your consumption of raw, fresh vegetables, ideally organic, is a great way of increasing calcium, optimizing your vitamin D levels, ideally from appropriate sun exposure. Vitamin D builds your bone density by helping your body absorb calcium. If you're looking for an oral supplement, we have a great product that has the D3 with the K2. Remember, the K2 keeps the calcium from going into the arteries, and you have to have it in the appropriate form, the MK7 K2 form, and the vitamin D3. In the natural form, we have that in the Ultra K2 D3. It's in a chewable product, so it's very easy to take and very highly absorbable. If you'd like to try the Ultra K2 D3, it's a great way to help prevent osteoporosis and treat osteoporosis in a safe way, because you're getting the K2. The L-arginine complete also has the K2 and the D3 in therapeutic amounts, as well as the L-arginine and the citrulline, which produces nitric oxide. So it also has that as well. It's in powdered form, so we do also offer that here at the American Back Centers if you'd like to try that as well. All right, we are short on time. If you'd like to get a copy of these articles, you can go to the Facebook page. I should have them up here soon. If not in the next hour, I should have them up there. American Back Centers Pittsburgh. Like our page. You can also go to McCool.com. If you don't have access to a internet or a computer, we can send those out to you free of charge. Anything we talk about on the show each and every week. All right, we are in our final moments of the show, so I'm going to leave you with some final closing thoughts. Again, remember, do your homework before pursuing any treatment option, including VaxD. Ask for the research. Go on the internet. Unfortunately, there's many people out there trying to scam you. I hate to say that. With VaxD, you don't have to worry about that. We have a proven track record, time-tested treatment, very well-researched treatment used worldwide at over 300 facilities. 3,000 patients a day are currently being treated with VaxD. Nothing comes close to that. No so-called disc treatment, decompression treatment out there. This treatment, VaxD, is accepted by all fields of healthcare, and most importantly, it's something that actually works. With VaxD, the results speak for themselves. I want to thank everyone for listening today. We'll be on next Wednesday and every Wednesday with another episode of Back Talk. This is Dr. Peter Pedduzi. Have a good week. Bye-bye.
You've been listening to Back Talk with Dr. Peter Pedduzi, sponsored by American Back Center, 103 Bradford Road, Building 2, Suite 100 in Wexford. For more information or to contact Dr. Pedduzi for an appointment, call 724-935-3300 or toll free 888-222-8293. That's 888-222-8293. And join us again for Back Talk with Dr. Peter Pedduzi.
At American Back Centers, you've got nothing to lose but the pain.